Welcome to the Easy Baby Podcast, where we share practical tips and information to make your pregnancy and the first months of your baby's life the best they can be. Visit easybaby.co.za for more information on our online courses.
Hello, moms and dads, and welcome to the 4th episode of the Easy Baby Podcast series. We are getting some great support and feedback from people in the industry, and I would like to start this episode by sending out a special thanks to the folks at Your Baby Magazine and Your Pregnancy Magazine, as well as Meg Fora from Baby Sense for tweeting out our last episode. It is thanks to people like you that our message gets out to parents that need it. And so make sure you follow them on Twitter, because not only are these people industry leaders, but it's a great way to find out when our next episode is available. So follow at Your Baby Mag, at Your Pregnancy ZA, at Baby Gear 2015, and at Meg Fora. So in the last episode, we talked about that dreaded 5-letter word, colic. We talked about what it is, what the different causes can be, and also, very importantly, what symptoms are not part of colic and which ones we need to be concerned about. So if you haven't checked out that episode yet, it's on our website at marinuschiropractic.co.za. Just look for the Easy Baby Podcast tab, and it's episode 3 titled What is Colic? So this episode is going to follow on to the last one, and we're going to be looking at potential long-term effects of having a colic baby, what we can do for these kids. And at the end of the show, I'd like to introduce you to the definition that I use in practice when it comes to excessively crying babies. So as always, please keep in mind that the Easy Baby Podcast is for reference only and should not take the place of your healthcare professional and his or her expertise in the diagnosis and treatment when it comes to the health of your baby. So we know that less than 5% of colic cases are actually linked to any underlying disease, which is a huge relief because it means that physically most of our colic babies aren't in any danger. We also know from the experts that colic goes away around 3 months of age. Now, the crying may go away at 3 months, but the problems that this kind of excessive behavior causes aren't just limited to your baby, and neither are the possible longer-lasting effects to the relationship between you and your child. In fact, there is research that shows that the most affected people by colic are actually the parents. So why are colic episodes so devastating for us as loving parents? Well, it's because they shut us out. The more we try and help during a colic episode, the more our babies yell. And unfortunately, that is exactly what's meant to happen during a colic episode. The job of an attack like this is to allow an overstimulated, possibly underdeveloped baby to shut out any more input from their surroundings. They're full. They've reached 100% capacity. They can't deal with any more input. So they close their eyes and they shout back at the world until they either balance themselves out or they fall asleep. So this leaves us as parents helpless until that attack is over. And for first-time parents, this can really rock you. You've spent all this time waiting excitedly for your new baby, and now you're almost cheated out of the experience because colic hits just as you expect your baby to start interacting with you. And interestingly, even if you're a second, third, or fourth-time mom, and this baby turns out to be colic while the other babies were fine, you were somehow by society expected to be the baby guru because you've already had kids. So you should know everything by now, and that can really shake your confidence to have a colic child. So you start to doubt yourself, and you're not able to live up to everyone else's expectation, but much more importantly, you're not able to live up to your own internal expectation. So in terms of long-term effects of colic, there are some studies that show that maybe there is a susceptibility to stomach pain and allergies, maybe up to 10 years later. There are other studies that suggest there are potentially links to food allergies, breathing issues, maybe even having more negative emotions later in life. But the biggest link and the newest link to colic at the moment is migraine. You are 7 times more likely to have had colic if you are a migraine sufferer. So excessive crying and fussiness take up your baby's time. It literally robs them of this state of what we like to call wide-eyed wonder that they need in the beginning to learn about the world. It's like trying to study for an exam with a migraine. You can't do it. All your energy and focus is taken up on what's happening inside you, and there's nothing left for what's going on outside. So babies need a finely balanced mix of being awake, alert, and relaxed to be able to grow those millions of connections in the brain. And that's why medications that zone them out, while they might mask the crying and calm your baby down, they take away that alertness, which means, yes, your baby might be relaxed, but not alert enough to be able to grow those brain connections. So we've basically landed ourselves back in the same problem again. And same goes for chronically overtired children. They can't relax because they're in this constant state of exhaustion. So going forward, we're looking for solutions that allow our babies to sleep well when they need to and be awake, alert, and relaxed when they're up. Now, because normal calming methods don't work on colic babies, unfortunately, this means that some babies do get handled more roughly than they should by otherwise completely rational, well-balanced parents who are just exhausted and frustrated, and they've just had too much to be able to control themselves properly. Never underestimate the effect of being subjected to hours and hours of a screaming baby. That cry is specifically designed to create tension inside you. Your blood pressure shoots through the roof, your heart rate spikes, and it puts you in that same fight or flight state that your baby's in. Now, you can't be in this state for very long without starting to make some bad decisions, which is why it is important to use your support network. If you feel that it's getting too much for you, you need to let someone else take care of your baby while you get some alone time. It's not weakness. This is not a sign of bad parenting. It's actually a sign that you're in touch with how you're feeling, and you're acting positively and responsibly by getting yourself out of the situation before you make a bad decision. Please remember, it's only recently in our Western culture that we barricade ourselves behind these big walls in our own houses, and we force ourselves to go through these first weeks alone. In traditional societies, the whole village is responsible for the baby, and the load is spread between helpers. Many of them have vast amounts of baby knowledge, and that gets passed down to the new parents, and we don't get that in our society. Maternal depression has been linked to mothers of colic babies, and it's important to look out for the signs. Dads, this is very much your job to check on mom's attitude and how she's feeling about herself and your baby, because she may not know that she's slipping into that depressive pattern because of so much that's going on around her. So the red flags here are finding it hard to take pleasure in your baby. Yes, the first couple of weeks are a tough time, but it overall should be a very positive experience. Look out for that disturbed sleeping pattern that has nothing to do with your baby's sleep time. Also, look out for anxiety, irritability, blaming yourself for every little thing that goes wrong. And some moms even swing completely the other way with postnatal depression, and they become obsessed with baby's health and obsessed with weight gain, and they fear that anything they do will hurt their baby. Even in my little group of friends, the stories of postnatal depression only came out 6 or 7 years after our kids were babies. And I was amazed at how many of my friends kept quiet and fought this alone because they thought of the social stigma that was potentially attached to this postnatal depression. So don't wait. If you feel yourself slipping, get help and get it fast. So what can we do for these babies that deal with these attacks? Well, I know I've made it sound pretty grim up to now, but there's actually quite a lot that we can do for them. And the first step is to go off to your pediatrician to make sure it is only colic. Refer back to our last episode and check out the conditions that present like colic but can be more troublesome. So like ear infections, bladder infections, thrush, that kind of thing. And on a quick side note here, have your phone out at a pediatrician consult. Record the consultation. There is so much information that you're presented with in those first couple of, or those few minutes that you spend in the consultation, and the majority of it just washes right over us. Because while we're there, we're worried about a million different things. We're worried that we want to ask all our questions. So that's another thing. Write your questions down so that when you get into that position, you've got everything in front of you. You don't forget something. You also want to record the conversation because you want to hear the diagnosis. You want to know what's wrong with your baby. And especially if you've been told to get medication, it's wonderful to have on record why you are having the medication, what the medication is for, and is it fine to have that medication with potentially other home remedies that you're using already.
Please feel free to contact the show at any time with questions you may have or topics you would like us to cover in future shows. Email us at info@easybaby.co.za.
So once that's done, and we know that it is colic, we start looking at what we can do at home. First one, quite obvious one, smoking. Smoking is a huge problem with colic babies because it leads to too much of a certain gut hormone and it adds to colic. It makes the intestines cramp. It weirdly is even worse if you don't smoke in pregnancy and then you start smoking again after you've had your baby. Because now baby is exposed all at once to the bad effects and they haven't had time to be able to build any tolerance in utero. So smoking is really bad for colic babies. Also, we want to get to know our baby's cues and cries so that we know what to change and when to change it for them. Because this prevents those cries developing into these big inconsolable fits. And I urge you, check out episodes 1 and 2 of our podcast series. We've got a lot of information on crying and what it means and how to be able to discern those cries. There is also at the moment great research concerning probiotics and colic babies. Caesar babies in particular end up with the completely wrong amount of bugs in their system because they don't go through the birth canal, and this messes up the fatty acid profile of their intestine, and basically that just favors colic. And for breastfeeding moms, about 15% of babies are sensitive to what you eat. But if you're in that group or you're not in that group, it's still a good idea to minimize those foods that cause trouble. So dairy, citrus, caffeine, leafy green vegetables, beans. Remove these or bring these down in your diet. And every mom and baby pair is different, but by eliminating those basic irritants, you just take pressure off your baby's system and it makes life easier for everybody. I would like you to Google a pediatrician called Harvey Karp. Actually, YouTube him, and I'll put a link in the description box. He came up with this novel system of calming babies down, which he calls the 5 S's. I'm going to run through them quickly with you. But the idea of these 5 S's is to recreate the womb situation for babies under 3 months because they respond really well to that. And he believes that if you get these 5 S's right, it kicks off a calming reflex. And I have found it really, really helpful in practice. So the first S is to swaddle your baby. The swaddling needs to be really nice and tight because we are recreating the feeling of being immersed in the uterus. Swaddling also keeps the baby's hands from flailing around and upsetting them when you're trying to get them to calm down. The second S stands for either side or stomach, and this is the way that we hold them when we go through this procedure. And this imitates their position that they had in the uterus. And really importantly, it switches off the Moro reflex, which is that one where they lie down and their hands fly out to their sides and their eyes fly open. Because this reflex is really strong when they lie on their backs because they have a feeling of free falling. And this can send them into a bit of a frenzy. So side lying allows them to relax, and lying on their stomach also, very relaxed position. The third S is for shh. It's their whale song. They love shh. That noise, and we make that noise to our babies. We hold them in, and instinctively we go shh. It's there because it mimics the sound of the placental blood flow before they're born. And you can shush them in their ears really, really loud. 80 to 90 decibels is the amount of sound, or the level of sound that babies are used to in utero. It's a high-pitched whooshing, and weirdly, the louder you do it, the more comforting it is. The fourth S is to swing. You need them. They're sea creatures still. They need to develop their land legs. They're like tiny little sailors. So what we need to do is have movement with them. So when we hold them, we need to swing them from side to side, almost like a little shiver mobilization that we give them. We want their head to jiggle just a little bit, just to get the proprioception going into the brain. Generally, if you can swing them at 120 beats per minute, that's pretty much the best. And also, we generally do it anyway, but we hold babies' heads to our left-hand sides so that they're right over our heart. Okay, and the last S is sucking, a dummy. Sucking is, what they do is something called non-nutritive sucking, which is double time of the usual sucking procedure that babies have when they're eating. And this releases natural chemicals in their brain that start to calm them down. So that's Harvey, Karp, and that's the 5 S's. I've just outlined it very basically for you, and I'd like you to just go and Google him and go and check out. There's a lot of stuff on him on YouTube. So now we talk about the manual therapies. So as a chiropractor, babies with excessive crying and niggling and fussing, they make up the most of my patients under 3 months old. And if that's the case, then how does chiropractic treat these conditions? Well, the short answer is it doesn't. The chiropractic treatment of babies is not focused on the symptom of crying, which is where there's a lot of misunderstanding on the internet and on the research. But rather what we look at is healthy spinal alignment and the impact that that has on the nervous system of your baby and the nervous system's ability to be able to work effectively inside their body. So even though we tend to find the same sorts of misalignment issues generally in babies, which is not surprising, seeing they've all just been born one way or another, there's still no one adjustment that we do that is specific for colic. Chiropractors assess each baby on a case-by-case basis, and we treat those children accordingly. The actual adjustments and the techniques that we use are very, very different to anything that you may be used to for having gone to a chiropractor for yourself as an adult. They're soft, they're gentle techniques, and they're aimed at taking the pressure off your child rather than putting the pressure on. But babies have been around for so much longer than chiropractors and NDT physios and osteopaths. So how come all of a sudden now these babies need manual treatment? Well, one reason is because our understanding of babies and their mechanics has become so much better over the last couple of years, and the research into the benefits of massage and mobilization and correction in babies shows overwhelmingly what we've known all the way along, which is that babies benefit from this kind of touch. Another reason that manual therapies work so well is that humans have changed. We began walking upright, and when we did that, we put an S curve into the birth canal, as well as we made it more constricted, as we've talked about in earlier episodes. Add to that the fact that the average newborn skull is about 11 centimeters diameter and the fully dilated cervix is only 10 centimeters, shows that newborn bodies go through a good deal more squeezing and pressure during a natural birth than just about any other animal. And that's not to say that the turning and the twisting through the birth canal is not a good thing. It's a really good thing because it squeezes excess fluid from the lungs and it opens a baby's posture from that rolled up fetal ball, and it allows them to be more straightened out. But through this, there is pressure that's put onto those tiny spines, and that pressure can benefit from being released. So the amount that these babies are able to open up depends on many things, like how long or short the active labor process was, what position the baby was lying in before the birth, the size of the baby relative to mom, and also if the birth was assisted by forceps or vacuum. So Caesar babies on the other hand, have no tractioning through the birth canal. So they have the opposite problem of being too tightly balled up, and they can also find much improvement from manual therapy. Lastly, I find real benefit from teaching the parents that come to my office to decompress their children properly. And what I mean by that is to get rid of the farts, get rid of the burps, so this gas doesn't build in the intestines and cause pain. It's generally not that these babies have more gas than any other babies, but with these babies, the intestines are more prone to cramping. So even if there's a slight amount of gas in their gastrointestinal tract, it becomes a source of a lot of pain. So knowing what signals to look for and how to effectively help babies get rid of this extra gas doesn't fix colic, but it really helps take the pressure off and keep their stimulation level under that colic limit that we've talked about. And it goes a long way to breaking down that colic cycle. In the beginning of the episode, I promised you a practical definition for colic babies. And this is the golden standard that I use in practice, and it incorporates one big factor that is always left out of every other diagnosis concerning excessive crying. And it's you, the parent, the caregiver. So here's what we use in practice. An otherwise healthy baby, well-fed, who cries inconsolably for any time period that puts the primary caregiver in a position of being unable to react positively to their baby's needs. That for us is colic. And because theoretically you could have a healthy baby that cries for 8 hours a day, but whose mother is supermom. She's designed to deal with the stress. She has a brilliant support structure which gives her the ability to take time away and regroup and come back revitalized and ready to deal with more crying. As long as that baby is healthy and the parent can deal with the crying in a positive way, there's essentially no problem. Compared to an overstressed single parent who has 2 other children and a weak support structure, even a half an hour of crying for this lady, which is inconsolable, which is high-pitched screeching, might be enough to cause irreparable damage to that family unit. And this brings me to the crux of the matter. When I see a new parent with a colic baby, I always hear the words, "my baby has colic." When they are more often than not, what they're trying to say is my relationship with my baby has colic. Because at the end of the day, that's what colic is all about. It has the potential to rob you of that early relationship with your child. It's near impossible to bond with a screaming infant, and that leads to future complication. So just because your baby maybe doesn't cry for 3 hours a day, blah, 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 doesn't mean that there's nothing that can be done. Finally, don't neglect your local baby clinic. The sisters there work with these kind of babies all day, every day. They are an invaluable source of information on just about anything baby related. So that is our show. That is episode 4, and I hope you enjoyed it. I hope you got some benefit. As always, if you found you did get benefit out of it and you think others might as well, please make sure that you leave us a rating on iTunes or Stitcher Radio, and you are more than welcome to share this episode on Facebook, Twitter. It's up to parents like you to get the word out to other parents so that we can get the right information to the right people. Thanks very much. Have fun with your babies, and I will be back with you next time.
If you enjoyed this episode, please subscribe. And remember to check out our pre- and postnatal education courses at easybaby.co.za. You got this.